Hello everyone. In this video, I will cover the national immunization schedule, including all of the vaccines that are given under it to infants as well as to pregnant women. At birth, we give three vaccines to the child: BCG, OPV, hepatitis B. Okay, so at birth, BCG, OPV, and hepatitis B, and OPV is OPV 0 dose. And if you look at the sounds, they all have a B kind of a sound. If you look very closely, so birth, BCG, hepatitis B, and if you imagine this V also to be a B, then all, you can remember this as a mnemonic. At birth, you give BCG, OPV, and hepatitis B. Next, at 6 weeks, we give the first dose of pentavalent, first dose of rotavirus, first dose of fractional IPV, first dose of OPV. The birth dose was 0 dose. At 6 weeks, we give the first dose, okay, and then first dose of PCV. So 6 weeks is when we give the first doses of everything. Everything is the first dose: pentavalent, rotavirus, IPV, OPV, and PCV. Everything is the first dose. Then at 10 weeks, there are two vaccines that are not given. IPV and PCV are not given. We give the other three: pentavalent, rotavirus, and OPV. These three are given and they are the second doses now. So at 10 weeks, we have the second doses of pentavalent, rotavirus, and OPV. No FIPV, no PCV. Okay. Then at 14 weeks, we give the third dose of pentavalent, the third dose of rotavirus, and the third dose of OPV. And we also give the second dose of fractional IPV and the second dose of PCV. Okay. These are 14 weeks. Pentavalent 3, rotavirus 3, OPV 3, and then fractional IPV 2, PCV 2. Next, at 9 to 12 months, the vaccines change. Now, these pentavalent and rotavirus, all of these are over. Vaccines change, and we come to measles rubella first dose, MR first dose. PCV is given as a booster. Fractional IPV third dose is given. We give the first dose of vitamin A and the first dose of Japanese encephalitis. Okay, so MR, PCV, third dose of fractional IPV, and first dose of Japanese encephalitis, along with one vitamin, which is vitamin A. This is what is given on 9 to 12 months. And 16 to 24 months, we give the first booster dose of DPT. So, this is what we do here: first booster dose of DPT, then we give an OPV booster. Remember, PCV booster was given in 9 to 12 months, then an OPV booster is given in 16 to 24 months. After the 14th week, OPV booster is given on 16 to 24 months. Remember this. After that, you give the second dose of measles rubella, second dose of Japanese encephalitis, second dose of vitamin A. Now, after this, after the second dose of vitamin A, this vitamin A will be followed by one dose every 6 months till 5 years of age. So, till the child turns 5 years of age, every 6 months, one dose of vitamin A is given to the child. So, again, let's recap what we have in 16 to 24 months. We have the booster dose of DPT, booster dose of OPV, second dose of measles rubella, second dose of Japanese encephalitis, and second dose of vitamin A. 5 to 6 years of age, we give the second booster of DPT. First booster was at 16 months, second booster is at 5 to 6 years. Then at 10 years of age, TD is given, T small d. Okay, T small d is given at 10 years and at 16 years of age. Finally, if pregnant women are also included in the national immunization schedule, and they are given two doses of TD. TD is given to pregnant women, two doses 4 weeks apart. So if one dose was given on the 12th week of conception, on the 12th week of pregnancy, then the second dose has to be given minimum after 16 weeks. And if the lady was vaccinated with these two doses within 3 years, so let's say the lady had a child 2 years back, and she was given this entire schedule, these two doses during that pregnancy, then what she needs is only a booster dose. She does not have to be given these two doses again. But if the child was born more than 3 years back, so if it's 2025 right now, if the child was born before 2022, or the woman was not vaccinated at all before with this regime, then both the doses have to be given.